As an employee, I was using e-MDs because I had seen the charting system many, many years ago when it first came out. And we had a billing and a scheduling system, but to add on at the time, this was 8, 9 years ago, another system wanted $25,000 to add in a charting program. And I thought that was really crazy, so I started with e-MDs full out with a billing, scheduling, and charting system. And I thought that using an integrated database would be the best way to go. I had been an employee, so I didn't really have total control of how we used the system back then. And for me, my old office didn't really understand how to use an electronic medical record to its maximal potential. They were kind of half paper, half electronic. And so here was my opportunity to go totally electronic and to use this system the way I've always wanted to do it. August 29th of 2005, at the time I was an employee, and we didn't have any type of computers for a while. So I learned how to function without a system because we had some backup ways of doing things. We contacted e-MDs and we got our systems back up running pretty quickly. The few weeks after that, my boss called and said she was closing my clinic. I was a satellite clinic of our main office, and my options were to move to Gulfport, where our main office was, or I didn't have a job. So within 24 hours, I decided I didn't have a job. The next 24 hours, I was building a business plan, contacting banks, having a very short time frame to get everything together. I made a timeline of 3 weeks, and I contacted e-MDs and I told them what I was doing, and they were extremely helpful to me to help me start my new business venture, because I knew I wanted to stick with e-MDs, and I knew that I had a very short time frame. I actually got my software on my own business venture the day before I opened. I installed my software. I had IT support to kind of get my lines up and running, but I really did the majority of the installation myself. And the next day I opened to patients. And at the time, e-MDs was tremendously valuable to me because I knew the charting system very well. I knew scheduling very well. But to be honest, I didn't have a clue on billing, and I just opened up my doors. So I learned the billing system for e-MDs basically by hook or by crook, because I needed a lot of help and I didn't have a lot of time to spend in terms of being trained and getting all the information I needed and how to do things. And I became totally functional with using the clearinghouse, Gateway EDI. I became very smart on how to do electronic remits as soon as I could get those up and running. So e-MDs basically helped me get through this process of opening up my own clinic because I knew the system well enough to build on what I already had. As a small business owner, as a nurse practitioner, which is kind of an unusual setting in our area anyway, e-MDs gave me the ability to not have to hire a lot of people to do things that I could learn myself. So originally, I did all the billing myself. I would see my patients between 8 and 5, and then I would put on my administrative hat, and I became the biller. And that the process of learning to process myself as the provider, and then as I got busier, I taught other staff members. And so I've got a nurse, I've got a medical assistant, and I have 2 part-time nursing students currently that help me with my small business. And e-MDs has allowed me not to have a staff of 20 or 10 because I know the system, I know what it takes to do the job, and I know what it takes to run a medical practice with a small, efficient staff. And using e-MDs is what helped me to become a very efficient micro medical clinic for diabetes, and that's my total focus. For my specialty, we use a lot of downloading capabilities, and we download glucometers, we download insulin pumps, we download mostly those devices, meters and that kind of stuff. And if I pull those into the medical record, especially the pump now, we make it a PDF file. Instead of having another separate thing where I need to look up data, we are pulling in these records with a PDF file to DocMan, and that is very helpful when I need to know very quickly where is this patient's status last time I saw them, if they need help, what were their other settings in their medical device, like their insulin pump, what were their sugars doing last time I saw them, or in the future. So we require patients to bring their devices with them so we can download it, and then we pull that data into e-MDs, and I love that feature.
Great.
I've had very good dealings with the support center, at least initially on when I really, I didn't have the training that I was supposed to because of my time constraints of opening up a clinic in 3 weeks. Had I been able to do the correct training, I probably wouldn't have had to call support as much as I did, but they were very, they had a designated person that I was calling at the time that really helped me to get my practice up and running and becoming efficiently as quickly as possible. I actually give some lectures locally, regionally, on nurse practitioners how to own their own clinic. And one of the first things I talk about in giving this workshop is choose whether you want to become electronic or paper. And I discuss, the benefits and the disadvantages of both. And for me, personally, the only way to go is to go electronic, because especially with the billing systems and less repetitive things that we're doing versus paper, that I think when you need to know what you've done in a day, what you've sent out in your claims, and what you've gotten back in a day in terms of reimbursement. Reimbursement is what's going to make you a very well successful business venture, and that's really what it comes down to, is making sure you're tracking your expenses and your income as you go. I won the 2007 Advanced for Nurse Practitioner Entrepreneur of the Year Award, and I credited my electronic medical record e-MDs for that win, because that's the system that made me as successful as I am. And I started out post-Hurricane Katrina, but I was able to become efficient and have a smart business practice by utilizing electronic medical records. And I think that part of my mission is to encourage other providers to become educated in electronic medical records and be open to switching, because I think that's where our future is for medical care. And it's certainly has helped me in terms of becoming a successful business, and in terms of watching my income and expenditures tracking very closely. So I appreciate e-MDs and what they've done for me in my clinic in my little world in Mississippi, and I like to encourage other people to look at this software and to utilize it as well.